Hydrogen breath test is the most commonly used method for diagnosis of fructose intolerance. But what if I tell you that it has its bad side? Personally, I have fructose intolerance and it wasn't diagnosed by hydrogen breath test. It was diagnosed by symptoms. It was so obvious that my gastrologist said that I have fructose intolerance, both with lactose intolerance. So it's more complex thing in my case, but still you can diagnose fructose intolerance without hydrogen breath test. So in this video I will tell you what hydrogen breath test is, what are its good sides, what are its bad sides, how to diagnose fructose malabsorption without hydrogen breath test, and also do I personally use hydrogen breath test in my consultations. There are different types of hydrogen breath test depending on what you want to see, what do you want to diagnose. So for example, we have hydrogen-methane breath test that is better than hydrogen breath test because it gives us more information. Also, we can diagnose SIBO, we can diagnose fructose or lactose intolerance by hydrogen breath test. And about SIBO and hydrogen breath test will be probably distinct video, but what I can tell you, it's not a gold standard for SIBO diagnosis. For fructose, it's the most available one. Hydrogen breath test uses the fact that hydrogen in your breath in bigger amount, bigger number, can occur only due to fermentation of carbohydrates in your intestines. So in the method, they give you 25 to 50 grams of fructose in a glass of water and you need to drink it. After every 15 to 30 minutes, they measure your hydrogen in your breath. It is measured for a few hours, and after about 60-70 minutes, there should occur a peak of your hydrogen if the test is positive. And why carbs digestion causes hydrogen peak? Because if you don't absorb fructose, it is fermented by gut bacteria into hydrogen, methane, CO2 and short-chain fatty acids. And as you see, two of those four are hydrogen and methane. So you can see if the fructose was absorbed or was it fermented. And if it's absorbed, blood glucose levels should increase. So in negative test, there will be blood glucose increase, but no hydrogen in breath increase. But in positive, there won't be really huge increase of blood glucose, but there will be hydrogen increased in your breath. So what are the good sides of the method? I think there are two. First, it's widely available. Second one, it is non-invasive method. So it doesn't involve going into your body, doing harm of your body. It's just drinking a glass of water with fructose and doing breath test for every 30 minutes. So it's not a big deal for you and for your body. Bad sides, there are more bad sides than good sides. But first one is occurrence of many confounders. Those confounders are smoking, that increases hydrogen in breath, exercise that decreases hydrogen level in breath, also high fiber diet before the test. It is recommended and doctors say that you should keep low fiber diet before doing the test. Also, you do it in fasting state, at least 10 to 12 hours of fasting, but still many people just forget about low fiber diet and it often gives you false positive. Also, it lacks specificity. And the other thing is we don't have uniform symptoms assessment. Different studies say different things. Different studies say what is positive result, what is negative result, what are definitions of those both. So there is really huge mess around the test. We don't have one definition of everything. As you can see, there are many disadvantages of the test. But what can you do instead? I recommend you food diary. Just write down everything you eat and how you feel even with symptoms after eating, 2, 3, 4 hours after eating a meal, and after a week or 2 weeks of eating with your diary. Show it to your nutritionist. If you don't have one and you need somebody to look at it, look at your health, you can book consultation with me. At the end of this video will be another video where you will see how consultations with me look like. The other thing is you can just go buy banana juice, drink glass, 2 glasses of it, and see how you feel. Why banana juice, not banana? Banana juice has low amount of fiber compared to banana, so there is less chance that fiber will increase your symptoms. But if you really need to be sure, you can try hydrogen breath test for fructose, but I would use all of those three. I would use hydrogen breath test, I would use just banana juice drinking, and food diary. Food diary is also important for other things, so you can look into what else can be not well with your health. And if you want to be sure and you want somebody to look at your health, evaluate if everything is alright, book consultation with me. But if you are not sure yet, watch the video on your right that will show up at the end of this video. If you are interested in more things about fructose and you have fructose intolerance, then look at my another video that is about link between fructose intolerance and depression. Thank you for watching. Comment what do you think. Have you ever done hydrogen breath test? Me personally, I haven't done that. I don't need it to be sure that I have fructose intolerance, but I'm curious, what is your opinion?